So thank you for the introduction. And you're right in what you say that I am incredibly proud to work in healthcare communications, but also I'm highly motivated by the ambition that we share, and that's not just to have a small impact on patients' lives, but perhaps go further than that and have a really profound impact on patients' lives and hopefully broader society. But before I start, I'd like to introduce you to Lucy, who's going to help me throughout with the presentation.
I didn't always have the luxury to go to lots of appointments. They don't really see how everything's impacting you as a person. I met a specialist nurse there who was amazing. The staff there were absolutely amazing, really attentive. I felt really safe. I was just quite at a low ebb at this point. Just the knowledge and hope that there was that light at the end of the tunnel now. It really did change my mindset. I was just not really thinking about the patient as a person, and then you sort of lose faith in the system. She took the time out to really understand my lifestyle, weren't signposting me to resources that I could access that information. She would email me and keep in touch with me through channels of communication that made it a lot easier. They just look at their specialist area and that's all they're concerned with, and once they think that, I can never thank them enough for how caring and compassionate they were.
So I met Lucy three weeks ago, and one of those encounters whereby it is both humbling but also inspiring when I listened to her determination to battle a condition, but also in her determination to help and support some of her fellow sufferers. So I'd like to tell you a little bit about Lucy's story, and then it'll hopefully set up the presentation. So 5 days before she was off to university, she was sadly diagnosed with type 1 diabetes. Things were set to take a turn for the worse when, after a serious case of pneumonia, she had severely deteriorated kidney function. The one thing that she was entirely committed to was retaining her independence and, where possible, avoiding dialysis. In what was a very unfortunate situation, the point of which she succumbed to dialysis was when she overheard her consultant speaking to one of their colleagues saying that if she doesn't voluntarily go on dialysis today, he'd have her sectioned. Now, for me, that is an example of really poor communication where we can have perhaps an impact. She was finally put forward for a simultaneous kidney and pancreas transplant, and what was quite sad is that on 2 separate occasions she was suspended from the list. Now, for me, I even have an issue with the word suspended from the list. It implies that she's done something wrong, which I think is inappropriate. She actually, on the second suspension, she was unfortunate enough to have her leg amputated below the knee, so it was a real battle for her all the way through the journey. Finally, this time last year, she got a phone call from the hospital to confirm that actually they had found a donation. And then she tells a really heartwarming story about her level-headed auntie battling from the Lake District to Manchester against sat-nav and a hospital security guard to get her to the ward for the donation. And now, while logic dictates, I was kind of gobsmacked to find out that actually she wasn't the only patient called in for that particular kidney and pancreas, but there was a handful of them. And they had to obviously then test for which would be the most relevant and most appropriate candidate. She found out that it was her as the porter wheeled her into surgery. And I'm really happy to say, as of today, she's well, she's independent, and now she's an absolute advocate for a more holistic patient journey. So that brings me to the topic today, which is smiles that save lives. And I think that the pharmaceutical industry can play an absolute role in delivering a much more holistic, seamless, and integrated patient journey. I also think that we have the skills and the creativity and the innovation to really drive forward communication that's sympathetic, empathetic, and considerate to patients. And I absolutely believe that we can improve outcomes for patients, therefore, hopefully ourselves and the broader society. So why is this relevant to the pharmaceutical industry? So this is a slide that I really believe in. And I think if we look at where we are today and where we have been in the history, our role as marketeers was to maximize the clinical data to drive market share. I think technology has afforded us the opportunity to do something much more significant. I think we can create tools and services and communication that actually can improve outcomes, and by improving outcomes, drive market share and our commercial success. So why is a smile so worthwhile? For me, there's a logical aspect to this. And for me, a happy patient is perhaps more likely to be a healthy patient. They're probably more likely to listen, they're more likely to commit, they're more likely to adhere, and I hope they've got more to live for. But as we were assembling and preparing the white paper that you have in front of you, and as we were preparing for today, we looked at a number of different clinical studies, and we found that subjective well-being actually went much, much further than just some of the softer, more cuddly aspects that I've just spoken about. And if you look at what it can do to improve cardiovascular in terms of reducing the risk of heart disease or improving cancer outcomes, that positive subjective well-being is definitely something where we can bring value and it'll have an impact on patients. We also will recognise that there is a big unmet emotional need. So if we take newly diagnosed cancer patients, 50% suffer with depression and anxiety to a point of which it's having a negative impact on their health. 40% heart attack patients, 40% of MS patients. What I find difficult about these facts is that these are our patients on our treatments, and it is absolutely within our power to drive and improve communication and provide that emotional support. So then we looked at a number of different studies that talk about what is it that makes a more happy patient, a more content patient. So we can see information, communication, and emotional support, all things that are within our power to absolutely improve. But beyond that, I'm absolutely convinced that as an industry, we can help to bring control to patients so they feel empowered. We can help to deliver this more holistic journey so that we have continuity. I think we can really influence the environments in which they exist and provide stability to their course of treatment. And obviously, we provide the treatment. But the point I'd like to make that I think Lucy makes really, really well is she says that consultants look at you and see the blood test, not a person. And we really need to change that mindset. But then when I think of us as an industry, I think that our focus is primarily based around the pill. We may talk about around the pill or beyond the pill, but we are still talking about the pill. When we start to think about the patient journey, we can start to see it's fragmented. We can start to see there's gaps and there's holes. And for me, this is the platform and the opportunity for the pharma industry to make a real difference and move more towards holistic support. So whether it's simple things like a conversation tool, a decision-making tool, connecting peers to peers and providing information, there is the opportunity for us to provide end-to-end support, hopefully improving outcomes for patients and perhaps driving our commercial success. David Blair of Google, who I think is fantastic, he talks about winning the moments that matter. The NHS describes this as sliding door moments. What they're talking about are these instances where decisions are made and actions are taken that have a direct impact on a patient's outcomes. Largely, these take place outside of the clinical setting. So it's our opportunity to help win as many of those moments with the right information and the right interaction to drive better success. So this was Lucy's story that I introduced you to before. One of the things I asked Lucy to do is actually plot out the moments where we did win as the broadest possible healthcare society. Where did we provide a really meaningful and positive interaction as she went from pre-diagnosis through to referral and then the follow-up. And you can see, in instances, as you saw from that opening clip, in places we do really, really well. I then asked her to plot all the places where we could have won and we could have made a real difference, where she was looking for support or she was looking for information. And you can see, in her opinion, there is a lot more that can be done. The brilliant Rebecca Oni also talks about this. And she says, if we know what it takes to have a healthcare system rather than a sick care system, then why don't we just do it? But of course, those are a lot of different points. So how can we possibly try and support them in each of those different instances? But we're afforded this great opportunity with technology to create really flexible solutions that actually can meet the needs of a patient's life. But also, I think they can be grouped. So we can talk about getting in, appropriate and timely referral. We can talk to getting to grips, so understanding your condition and coming to terms with it. We can talk about getting what you want and having that sense of ownership over your treatment pathway. Getting comfortable with your changing circumstances, and then obviously getting on with your life. So in terms of getting in, I want Lucy to talk you through her experience.
A lot of the time, you don't even know the questions that you need to be asking. And sometimes, on hindsight, you go home and think, oh, maybe I should have asked this, or I should have asked that. But if you're not medically trained, and it's a procedure that you know nothing about, then at the time you're receiving the information, it can be quite overwhelming.
I think we'd all agree at the referral process, communication is critical. It's clearly going to be a time-sensitive issue. But we know as well that patients typically put off assessment when they're doing the list of things to do. It's usually at the bottom of the list, and it's what they're going to do next week. And I think we can play a role in changing that. We also recognise, as Lucy just described, that patients might arrive at that consultation unprepared, and they walk out going, damn it, I wish I'd asked that question. The byproduct of that is that perhaps we miss these vital diagnosis windows. And this isn't just at the start of the journey, this is all the way through that breakdown in communications. So I've got a campaign that was produced in South America that I think really tackles that activation and validation of symptoms. With that campaign, you know what, the results weren't the best, but my God, it was a step in the right direction of using creativity and technology to try and do something very different. The next is the Khan Academy. So my son were just starting to think about schools, and I was talking to one of the schools, and they spoke about this Khan Academy, which I thought was fantastic. So it's a flipped classroom concept. So instead of learning in class, you actually learn before you go to class. And it means that when you arrive, you can then validate your learning, you can have challenging conversations with the teacher, and you can discuss ideas. The brilliant David Rosnan at the highly regarded Mayo Clinic has brought this model into healthcare. They make sure that as patients come for their consultation, they're absolutely aware of the details around the condition. What they're doing is going to maximize that valuable, critical time with the healthcare professional. The way this comes together is that we can activate and validate people's symptoms, make them go and have that consultation. And when they have that consultation, provide the education that's going to deliver effective and timely referrals. Because we recognise with timely referrals, we have a better chance of success and perhaps enhance our brand performance. Next, we come to getting to grips. So in terms of starting to understand your condition and come to terms with your condition so you can start to think about how you're going to beat it. And again, I'll hand over to Lucy.
I often felt quite alone, not knowing any fellow amputees, and I still actually don't know any patients that have had a pancreas kidney transplant.
Amazing, right? So just to be clear, Lucy is a digital native, for want of a better word, and yet she's never had an interaction with someone that has been through with her condition, either before to provide her with support or post so she can help her patients around that. From the NHS, 1 in 5 people believe they don't get enough information, so a clear opportunity for us to play a role in that. Now, I actually did a search on Google when I was preparing for this, and I typed in, I found a lump, and I got 48.1 million search results. Now, I am an ambassador for pharmaceutical-sponsored websites, but in some respects, I'm a slightly lone voice. But I put to you that when you're faced with over 48 million search results, a global corporation that is highly regulated really isn't the worst place to start. So there is an opportunity for us to provide that valuable information with credibility. Then in terms of social media, I think there's 2 aspects to this. One is connecting peers to peers, and the second is to deliver that emotional support. Organisations like Recovery, Frank, Childline work in very sensitive areas. They have some of the same concerns that we do. Okay, the charities, but they still have a certain degree of reluctance. They've overcome that to create communities that are focused and built around the patient. But I have a really important point. Just because we don't do social media doesn't mean we shouldn't do nothing. So when we start to think about the emotional support, we have things like the CSU app, which talks about people's quality of life. We then have some fantastic work in oncology that allows people to articulate their emotional distress. So we're providing the tools so they can go and see the healthcare professional and bring their unmet emotional needs to the table and start to move it forward.
They'd leave me leaflets on my bed of scary pictures of humongous dialysis machines attached to people, and I just thought, I can't even bear to look at that.
So I'm from a creative agency. I'm sure there's creative agencies in the room, and you definitely work with creative agencies. To hear that in 2015 that is how information has been delivered to a patient is, for me, deeply disturbing. And that's why creativity, I think, is really critical. And it's around crafting that information, being empathetic, having that touch of humanity and consideration to make sure it resonates in the right way and can be as effective as it possibly can. Contrary to that, and this is a piece of print, not digital, which is unusual for me, is Mother Book, which is produced by Dentsu, which is a pregnancy diary, and it's beautifully crafted. It exists over 40 spreads for 40 weeks. It shies away from copy and chooses to use illustration, and it's just a very considerate and empathetic way to deliver the message and take what could be a daunting and long process for, the expectant mother and making it something that's much more understandable and provide that support all the way through. A great example of how creativity can really make a difference. So ultimately, when we consider this getting to grips, it's about connecting the patients with information, hopefully their peers. It's about bringing that realization about their condition and the acceptance, because we know that engaged patients are likely to improve performance. So then it comes to getting what you want. So in almost every aspect of our lives, we have a sense of control over our experiences. We like to feel that ownership, except it will transpire them when we're a patient, where we're often dictated to us about the treatment that we're going through, losing that ownership and perhaps that empowerment.
I think when I was really ill, I felt quite powerless. I think sometimes I had to take control of my own health to make things happen. So you end up going to different hospitals, nobody knows what your history is, you end up repeating yourself quite a lot, and doctors don't even communicate between themselves, even in the same hospital. So that level of communication is really fragmented and really frustrating.
And clearly an area where we can have an impact. So this is, for me, described beautifully by Dr. Susan Hill. My patients sometimes refuse treatment or fail to take it because they don't feel they have ownership. They feel that their treatment is being imposed on them. And it comes back to that empowerment and what I would describe as active engagement. Somebody who is trying to tackle that is Patients Know Best. So it's a British tech startup, and what they're trying to do is take the financial model and provide access to individuals to their clinical data anywhere and any time to bring that sense of control. It allows them to see, hopefully, lab results, their program of care, and connect with the healthcare professionals. So it's giving them that control over their condition that they're looking for. Lucy's talked about, and I've mentioned it, this holistic, seamless, integrated patient journey. Now, I think patients recognise that they're obviously niche in their expertise, but as Lucy describes, they should be exchanging information. For those of you who went to the awards last night, Care for Today and Janssen Healthcare Innovations won two gongs. They got Best Healthcare Professional Initiative and Best Patient Initiative. I'm really proud to say that we're the technology partner for that, and what they have achieved is this seamless journey for patients.
Cardiovascular disease is the leading cause of death both in the UK and worldwide, with the cost of the UK healthcare system reaching £8.7 billion. Well, to address this, Janssen Healthcare Innovation is piloting a new rehabilitation scheme. We went to find out more.
Exercising on a Wednesday afternoon in High Wycombe. It could be the gym, but in fact it's an exercise class at Wycombe Hospital in Buckinghamshire for patients undergoing cardiac rehabilitation.
It's made me exercise my heart, and it's made me work my heart instead of being a little bit afraid of it.
It does stretch you that bit further.
In the past, about 50% of people would be looking for cardiac rehabilitation, and the other 50% weren't really that bothered. I think it's partly because we didn't have a bespoke area in the hospital where we could offer it, where comfortable surroundings with good educational material.
Great choice by the judges. So when we look at what we're talking about here, it's about giving people that sense of ownership. So we as an industry perhaps facilitating these patient-driven, patient-chosen experiences. And then driving this more cohesive and integrated and seamless journey, which hopefully points towards a more rapid recovery and driving treatment efficiencies. So at this point, we've had the effective and the timely referrals, we've had patients get to grips with their condition, and now we've had given them the sense of ownership through getting what they want. The next is around getting comfortable.
In the first week, you know, I was sort of drugged up with morphine and everything for the pain relief, and so I would quite often hallucinate and have bad dreams. And this particular wall that faced me in ICU was really garish. It was flowers, but not painted in a very poetic way, just very bright colours. And every time I woke up and was faced with this wall, I would just see dragons breathing fire and really scary images. And I just thought there's probably nicer things to wake up to.
So I don't want to duplicate what Lucy said, but I came across this quote and I just thought it was really quite provocative and also disturbing, again, going back to 2015. Every time I go for a checkup, I have to sit alongside women going for scans and experiencing the joy of being pregnant, knowing that my womb cancer has robbed me of any chance to have my own child. Like, we have to exist in a society where this is not taking place, and I'm convinced that we can play a role in making that happen. On the more positive approach, there is a New York nursing home, and they appointed a new medical director, and he arrived there, and what he saw he found really, really depressing. So he saw people that had previously been active and independent becoming more passive and disconsolate. And what he saw was 3 real plagues around hopelessness, loneliness, and also boredom. And this is what he really wanted to tackle. So he brought life to the clinic. He brought loads of dogs in, he brought cats in, he brought a cockatoo, he brought a load of hens that laid eggs, he brought children, he filled the place with plants. He took a place that was filled with death and transformed it into a place that was celebrating life. And the results were significant. So when we compare the facility, Chase Memorial Nursing Home, to a comparable facility, their drug spend was just 38%, so a saving of 62%. Which is an interesting point to make at a pharmaceutical conference, but I'm sure that could be reinvested elsewhere to drive better outcomes. They also saw a drop of 15% in terms of the rate of deaths. So what does this mean to the people in this room? If you look at Macmillan, they take their expertise and their funding and they create oncology units that really bring a quality and a sympathy to the patients. And I don't see why pharma couldn't be the same. I think it is an opportunity for us to develop some corporate brand equity and make a real difference to patients' lives. We might not save any lives, but we're certainly going to make them smile that little bit more. So that finally brings me to getting on. And I guess the question you're asking at this point is, at what point do we draw the line? How far do we have to go as an industry? Now, Lucy's not at this point at the moment, so instead I'm going to introduce you to Dave and Nikki.
You kind of imagine that the state will be there, all of those years of paying national insurance, you kind of imagine that that will come to your rescue, and it didn't.
I was being called a liar, and as the time was going on, we had different appeals.
So that's 13 months worth of fighting. We had to go to tribunal, didn't we?
That's right. And all this time, the anxiety, it wasn't getting any better, it was getting worse. Finances were affected badly, so every day was getting worse.
We were more than affected badly, actually. We had to sell everything that we had. It was this feeling of a system wanting to just break you, just really break you.
So the role that I think we can play, and that is in terms of using our insight and our creativity to take perhaps isolated individuals with chronic conditions and bring them together as a community, galvanise them so that they can lobby and challenge for rights, so that they're not just being treated as a patient, but as a person. And there is a fantastic example of this from Australia that I'd like to show you.
Dear Prime Minister, I'm one of thousands of young Australians with Duchenne muscular dystrophy. My heart and breathing muscles are failing, and my arms are so weak I can no longer lift a pen. Eventually, it will take my life. Clinical trials are the only hope we have, but we need the money to fund them. Can you please help us? Signed, Jacob Lancaster.
Now, they're calling it the most powerful arm ever invented.
Tonight we meet a remarkable young man.
Jacob is a passionate advocate for more research into DMD. Just by logging on to the campaign website, anyone can add their name to the petition, which urges the federal government to match the $1.75 million raised to help fund research.
To make the arm even more powerful, we gave it Jacob's handwriting sampled from the last thing he was able to write, a Mother's Day card. As well as streaming live video of the signings, a photo of the user's signature was then instantly uploaded from the site onto their Facebook wall. Over 60,000 website visits with an average dwell time of over 2.5 minutes. 20,000 signatures were signed in just 10 days, generating over 2 million Facebook impressions.
For me, that's got to be the benchmark and the ambition for what we should be hoping to achieve and the level of creativity that we should be demonstrating. So that brings me to the conclusion, and I opened up by asking, should we be focused around the pill or around the patient? Clearly, I believe it should be around the patient. And I think using that science, the insight, the creativity, and the innovation, we can really work to improve patient outcomes. And in doing so, society outcomes, and really kind of move forward. And my ultimate point is that I think we have the skills, not just to sell treatments, but to really make a difference. And if we're not going to save lives, we certainly have the opportunity to make people smile and make a real difference. So I'm just going to hand finally over to Lucy, who will say in 1 minute what I tried to say in 30.
I was in hospital this night and I couldn't sleep, and I was flicking through the channels. I saw this film and it had Sandra Bullock in, and I thought, no, that's not my cup of tea. I won't find that funny at all. And it was called The Heat or something. So I put it on, and then within the first sort of 10 minutes, I was just laughing, and I hadn't felt like I'd laughed like that for actually years, and it was just such a release of emotion, and it brought a tear to my eye for sadness and joy, because I was just laughing out loud, and I couldn't just remember the last time that I'd done that.
Thank you.
David, thank you so much. Highly inspiring.